Okay, I think we're recording now. And y'all have the not the mic, I guess.
Okay, cool. I will start. Stephanie, I know it's gonna sound like I feel like I'm just talking to Stephanie, but I'm gonna act as if there are a lot of people here. Cool. So my name is Alaina. Andrea and I are working on a grant through the Sheridan Health Clinic. And what we're trying to do is create a youth advisory council in the community. And our goal in doing that is really just to learn from you all and find out about what you're seeing that we could be doing differently or better in terms of providing for the community. And then we also want to share some information throughout meetings that you all can share and spread out to your friends and peers. So really, we're just wanting to be more involved with youth and implement our knowledge, because even though we're a school-based clinic, we know that we don't reach everyone. So we'd really like to reach more people to give them education about mental health, substance use, sexual health, general health, and to let them know that the clinic is here as a resource. So in terms of what we'd be looking for people who would be interested in joining our council, we're wanting this to be youth-led. So if you're a member, you'd be involved in all aspects of the program. You'd be attending and participating in meetings. You would choose project topics and you would decide how to run the projects. And if there are any activities that you wanted to do, you would decide that as well. And then Drea and I would be providing support, structure, and any resources and anything else that you might think that we could be helpful for. And the projects could be about really anything that you're wanting. So maybe it's something that you feel needs to be addressed in the community, or something that you just want to learn more about yourself. Like we heard that you wanted to learn more about mental health. So it could be just like that. You pick a topic and we'll bring some resources, we'll share them. We could discuss them at a meeting, and then you would decide how you want to share that with your peers in the community, and we'll help you to do that. And Drea did bring some resources, and we can talk about some mental health stuff as well. And then just to give some ideas of other project topics, it could be like bullying prevention, drug and alcohol awareness, nutrition, teen pregnancy prevention, dating violence awareness, just kind of stuff along that. And then ideally, we'd be wanting to have meetings once a month and work on a different topic at every meeting, but that's also something that we're open to input on. So we'd love to hear what would be most effective. What do you think people would respond best to in the community, and what would work best for you as a potential council member? And then we did want to share that at every single meeting, we are planning on giving out gift cards as kind of like a bonus treat for attending. And yeah, does anyone have any questions? That's really my whole spiel.
How many topics can you cover, in general? Like, is there a limit, or it's just?
No. I think it would probably depend on how often people wanted this to be included in the meeting. So if people were wanting the Youth Advisory Council to be every other week, then we could cover more topics. If they just wanted it once a month, we'd obviously be covering less. There's no limit to how many we can do. I think we're mostly just limited by when the school year ends, I guess. So
yeah, and I guess we'll kind of like schedule it yearly kind of thing, or semester, or like a semester, a quarter, however we think how much information we need to give towards this topic. We'll kind of like figure out what we need, maybe about 10 weeks for this activity, or maybe 2 weeks for something, It's simple. So we can, figure out a schedule, but we're here now. And so we're just, ready. Also, when the mental health that you asked for, the resources, I'm gonna send a file on the chat. So if I remember how to do this, this sheet that I'm gonna send to you guys, or maybe I'll just email it to you, Dee, so you could forward it to everybody. So this is the resources we have as a clinic that we have kept throughout the years. So what it is a list of a lot of facilities, places, programs that deal with a lot of mental health, family and home services, outpatient services, psychiatric services, community-based services, residential treatment, detox, therapy. Let's see what else. This is just a lot of information. There's a lot of these places have many resources for whoever's wanting help in any kind of mental health. It could be, individual therapy, group therapy, family therapy, all these stuff. So these places we refer out. If we can't do it, we refer out. However, for the school setting, like at the middle school, the high school, we are the first resource for mental health. So we can make, the students our patients and have them come here for their therapy because it's more convenient, coming here. It's just across the street or a block away kind of thing. And we have wonderful providers. We have Maria, who is bilingual, Victor, who is bilingual as well. And we're hiring a new one. I don't know when, but we're hiring new providers for behavioral health. So we are the main source for your mental health. If you are having, students or someone from your group like wanting help, even if it's simple as therapy or if they need some kind of treatment, we're here to help. Okay. You can always send them my way. You can email me or send me a WhatsApp and let me know, hey, this student wants, help. This is what he needs. And I will get him started or her right away, so that's what we're here for. That's why the clinic is here to help the students. So I will email this to you, Dee, so you can pass it along. And if there's any questions about these places, you can always ask me, and then I'll let you know.
That's awesome. Thank you. I have a couple questions. First one is relating to what you were just talking about. So are the services provided through the school-based clinic free, or would students have to have health insurance?
So most of our population are Hispanic and bilingual, and we know in our roots that health insurance is very hard to get. We do have an outreach enrollment system or a program where we help them apply for Medicaid, which Medicaid is the main insurance, right? That mostly a lot of places accept, and we accept it as well. We do have a discount sliding program, which what it is that they will have to have their parents apply for this discount so they can be able to get services. However, we try not to make those barriers for them to come. If you need help in the financial needs are a barrier, we don't make it a big deal. We'll talk about it later. Okay, let's get you started and then we'll talk about that later. So they could come with no insurance, with nothing, even I also wanted to send you a health rights. I don't know if you heard of the health rights for our teenagers who are 12 and over, have consent of their own mental health treatment. And that means seeking therapy, right? If they're 12 and they're wanting to get therapy, they can come without their parents. Okay, they are their own consent. All right. However, it is limited to the treatment they receive. So if let's say they have an evaluation and they get therapy and everything, but somehow in that process they need medication. So that's when we have to, involve the parents for their consent. Okay. That's another form I will send you. It's in Spanish and English. I will send you that form so you can post it in the bathroom. We have it in our bathroom, so our patients know, like, hey, you have rights. You have rights. Like, don't be afraid of asking for help if you don't want your parents to know. We're here to help. Okay.
Mhm.
So I'll send you that too. But yeah, the insurance and financial, we try not to make it a barrier, but we do help with that. If it is like an issue, we'll help.
Mhm.
Okay.
That's really good to hear. I'm happy to hear that. I'm still on Medicaid, so like I'm
Yeah.
really happy that those services are available.
Yeah.
Does anyone have any more questions about this? Because I have more like technical questions about the group. No?
I just have a comment that if only I knew that this was around when I was younger, I would have taken advantage of it. So because life happens, and I was like, what if I like need a therapist or something? But it was always like, what if I have to pay thousands of dollars just to get an evaluation, or go in to talk to a doctor or whatever. So I'm really glad that this is opening up for our youth, to have that opportunity that I didn't know of when I was younger.
Yeah. I can hear you. Like, me too. Like, if I knew I had resources, who knows, I wouldn't been a mom or stuff like that. So that's why I'm here. That's why I'm here to like help you spread the word and let everybody know, hey, you're not alone. You might be in high school and middle school and you have so many questions, you have so many things going on in your life that sometimes you can't even like depend on your parents. It's so hard. So we that's why we're here. We're like, okay, well, if they can't go to the parents, then who are they going to go to? Right. So let's lend a hand and help, be like, hey, we're here to help you, and we make the rules. Don't worry, we won't tell. Everything's confidential. Whatever you want it to be confidential, it will be. We will respect your rights. Okay. So yes, I'm really happy to hear that we're finally here to help out there.
Mhm. Yeah, and I feel like this is a lot of what the youth want to hear. They had mentioned that one of the issues that they face in the school is that there's a lack of mental health resources. They're like readily available and accessible, especially like within the school. So like when they go and they share something with their counselors, they don't never provide like places that they can keep talking about this or where they can find help. So I think that this might even be like a workshop or an outlet or some sort of work that the council and this group can like collaborate on in the future. But yeah, I think that'd be really
we
cool.
could definitely make it a workshop, because in that we can brainstorm other places are close by that accept insurance, that won't make it a big deal. But as long as you have insurance, right, it's easier to get somewhere. We could definitely work on that. I know there's a lot of places around here that we collaborate with, like the All Health, the Crisis Center. There's this other place over here on Hampton. So like, yeah, there's a lot of places that will all work together to help these students. So if it doesn't work out here, let's go work out somewhere else, close by, by the school, because I mean, I feel it's more convenient. Like, you're getting out of school, you're going straight to a therapy kind of thing, or, whatever. So yeah, we could definitely make it a workshop.
Awesome. And how many youth are you all like have funding for? Like, do you have a number of kids that y'all are aiming to get in?
I think, let me look on the grant. I think the grant listed maybe a lower number just because we weren't anticipating it being possible to get a lot of people, but I don't think that I should just look up before I say this.
Yeah,
Yeah.
How many members would you say are in the youth council or your Sheridan Rising Together? How many people are in it?
like 8 on a
Oh,
good
that
day.
that would be fine. Yeah.
Yeah.
I think it
That would-
was like 5 to 10, didn't we say?
Oh, okay.
10.
Yeah, that's
Yeah.
definitely achievable. I was like, if you're looking for more than 10,
Mm,
I would
no,
maybe change your your
I think
wording.
5 was the number I had in my head.
Okay.
There's just
yeah, 5 was
There's
my
just
number
on here.
2, but Lexi always likes to go like, hey, we could do 10. You never know, you know.
Mhm.
So yeah,
Yeah. 5's fine, 8's fine. Where I can't even find where it is in the document.
Okay,
I
no
should have
worries,
looked
no
this up
worries.
before.
You don't have to find it right away. Just kind of wanted to get an idea of like if we should recruit outside of the council in case we don't have enough like, interested members here. Because there's other organization that I work for. We do have a couple kids who are thinking about going into like the medical field. And so just wanted to like give them an opportunity to come into the space as well.
I found it. It says at least 5.
Oh, okay.
So it's a yes and yes.
Okay, I think 5 we can definitely do.
Yeah. We can chat with Lexi. I think we could, in theory, do more. I think we only have limited funding for gift cards. That's
Yeah.
the only like thing we'd have for numbers on. So if it was like 30 people, that might pose a problem. But if you have people from another group that you're working with that would be interested, that would be awesome.
Yeah, we could always work it out later with the budgeting because, I mean, gift cards are not as, they're not hard to get.
Yeah.
Because we have other donations, we have other sponsors who help us out. So, but yeah, for now, I guess we'll do 5.
Okay.
And see how that goes.
Awesome. And I know we had talked about this a couple of times before speaking with the youth, but we kind of wanted to leave it up to the youth about what that structure is going to look like if we wanted to be like a subsection of the youth council, if we wanted to integrate it into our own meetings. I would just want to hear from you both, like, how do you all foresee like this being most effective? Like, would you all like to like be part of every meeting that we have, or like creating like a separate group of youth? What would be like the most effective way for you all to like fulfill your grant requirements, I guess?
You had mentioned that you thought it would be easier if we integrated because it was hard to get people to even attend meetings. So I feel like that makes me want to say that it'd be easier to integrate rather than setting a separate meeting date. But for me personally, I can't speak for Dre, but for me personally, I could do a separate meeting date and time easily. I think it would just be up to what worked for council members.
Yeah.
And we also don't want to be imposing on your time if it's an imposition for us to integrate with you. We're not wanting to step on your toes, but
yeah, that was my insight too. Like, I didn't want to like take over your time that you have your meeting. But if participation is, an issue, which I mean, it's understandable, everybody's busy. We can try to integrate and see how that goes, half and half kind of thing. Or we could do separate. I could do separate as well, but I am limited in the time because I am, I work here as a full-time, and I'm only doing this grant because I requested it years ago, like 2 years ago, and they finally got it. And so my boss knows that, I want to work this grant.
Yeah.
And so as long as I have like my priorities in check and I have managed my time with other job duties, she said it was fine. So and I know I can do it, no worries. But I could definitely do another day, but the only days I have is, Tuesday or Thursdays are the only free times that I kind of have. And at this hour, honestly, it's perfect for me, but I don't know for Alaina if it's okay or not.
Okay. Okay, well, that's good to hear.
Yeah.
And this grant is going until the end of the school year. Would it be renewed for the next school year?
Yes, we would have, so whatever we work on this year, so we have to write about it and how it like made a difference and how it affected other students and how great it was. We have to write all of that. And if it was successful, and if the people in the grant approve for another year for it to keep going, then yes, we will have it for another year. But for now, it's just this year. So I'm really, really, really hoping that they can approve one more year. And it's going to be like that every year because grants, they're annually kind of thing. So it's different every year. So if we do have a success with this, you cancel. I mean, I'm pretty sure we'll be able to have another year.
Okay. Fanny, Lucia, do y'all have any more questions?
I guess I do have a question regarding the group, the number of students involved in the group. Would this be a potential opportunity for the high school kids to join once we're like getting started and going? Would you guys be interested in taking it to the high school and for more kids to join? Or would you just rather have it 8, 10 max?
I mean, if we see that, the participation and everything's flowing really well, and we're seeing that a lot of people are like, oh my God, I'm interested, then yes, we can discuss to involve more people. And that we would have to discuss that with Lexi, who, provided the grant and everything. So we'll let her know and see what she says. But I think it is a possibility, and I definitely would want more people involved. So yes, but we will have to just make sure we're okay with everything due to the budgeting and all that stuff.
Yeah.
And I don't know if we stated this before, but it's just for Sheridan community only.
Did we talk about that, Alaina? I don't
No, I mean, I'm looking at the grant reading right now. I think she just proposed it for Sheridan Youth, but I don't think would be like, you don't live in this county, get out.
Oh yeah.
Yeah.
No, I think
I think the goal is as many youths. I don't think she's ever gonna say no.
Yeah.
Being involved. So
yeah, because I mean that's what we do too at the clinic. I mean, we don't see just Sheridan residents. We see everybody. There's patients that live in Thornton. They come all over here to see us. So honestly, anybody can join.
Okay. Yeah, because I'm only asking because I have people that I know and stuff that don't live in Sheridan, but they are interested in programs and activities such as this one. But the only thing is that sometimes it's limited to only Sheridan.
Oh, no, not with us.
Yeah, okay, sounds good.
Any more question, guys?
Stephanie, did we answer your question in that or not? She asked if there are a few students that are interested. We did. Okay. Yeah, I think like Drea said, we would just have to check or confirm with Lexi, but I don't think that she's ever going to say no to more people being involved. So I think the reason she said at least 5 was because she wasn't thinking that many people would actively joining. So
I mean, the goal is to get as many as we can, because the goal is to spread out the word out there, like letting people know, hey, we exist, we're here to help. So as much as we can get, that'll be great. We'll manage. We'll manage all of that. Dee, I send you the fly. I sent you a flyer. I send you the resources, and then I send you both English and Spanish on the health rights of 14s for you guys to have. The flyer that I send you, that's our youth council flyer. So it's a little like example of what someone would do in the council. It's like a little like,
Oh, okay.
you see it?
Like a promotional.
It's
Yeah,
what we would have like passed out if this was in person, to be like, here we
Oh,
go.
Yeah, we can send this out to the youth, and if it's okay with y'all, we can even post this on Sheridan Rising social media.
oh, perfect. Yay.
Yeah. I'm sure we should
Yes,
do that.
yes. That would be great. So we can see how much response we get from that, and
Mhm.
hopefully we get started soon.
Stephanie, I don't think you have to have a certain age. I think I don't remember seeing anything about there being an age requirement. Is that right, Drea?
Yeah, I don't think there's a age limit. No, I mean, middle school can come up. We're focusing on the high school just because we're like, okay, let's just start at the high school kind of thing, you know. That was just our little guide, but we can go high school, middle school, and like even elementary if you know, if it works out. But yeah, we can, there's no age limit, honestly.
Any more questions, y'all?
By when would you want to get the council going? Is there like a goal date, or
Whenever we had enough people to form a group, probably.
Yeah, as soon as we,
Yeah.
you know, have that number, then we'll be like, okay, we have the number, we'll start that week, you know.
okay, okay.
Well, I think that from here, it'd be best to probably send this recording out to the rest of the youth, and maybe check in with them early next week, see if anybody's interested in pursuing this, like as like in what form they want to pursue it, I guess. If we want to do this as like there's enough interest in the whole council, we want to just make this a part of the council, or if we want to do another group because we don't have enough kids interested. But we can touch base maybe later next week, and maybe set a date for the first meeting. I feel like that's like always like the best, is to be like, all right, this is the first meeting, like come, there's food, there's gift cards, and people can gauge it, and yeah, we can just chat about it then. I don't want to speak too soon before we have youth input.
Yeah.
And then on that note, Dee, I like your idea. We can also have the meeting at the youth health clinic, so you guys can come and look at the clinic.
Mhm.
And you know, we want you to come and see it, and you know where it's at, and then also like if the youth will give us some kind of feedback of things that they liked or they didn't like, or you know, this color is too bright, or this or something, you know, like we're
Mhm.
always looking for input and how to decorate our office. You know, it's like we want to make it friendly and welcoming, and like, hey, you know, not like an old doctor office, like, you know, let's make it more, you know, it's more fun kind of thing. So we could definitely do that, so that way they can have a tour here at the clinic.
Mhm. That actually sounds like really exciting for the first meeting. It gets people excited to be able to meet in person and see
yeah.
face. So
Yeah,
we'll
yeah,
help
it sounds
them
great.
out.
And also let them know that this participation, not only will they, you know, get gift cards, but they also get skills and that they could put in their resume for future stuff. You know, these kind of programs that they join, their leadership skills, so that goes in the resume, so it looks good, you know, kind of thing.
Mhm. Awesome. Well, if there's no more questions, we really appreciate y'all coming to meet with us, and especially your flexibility and your patience with the constant rescheduling. Oh, Fanny, do you have a question?
Yes. So
Go for
I
it.
don't know if it sounds like kind of fencing or something like that, but like some of the students would like to join because um we don't have community service right now. So and we need to get the hours so we can graduate. So would this work as community service or something like that?
What a good question, Stephanie. Um, is it the community service you're saying, is it because of school? The school is asking you for community service
Yes.
for school? Yeah, so, let me run it by Lexi so she can talk to either the dean or the principal and let them know, like, hey, maybe some students would like to join our council so they can, do community service hours with us, because it is community service. You are coming in to help out, spread out the word about all these, topics that we want people to know, that we're here to help with health, mental health, nutrition, all these stuff that we want everybody to know and be educated on. So I will run that by Lexi tomorrow, and then I will email Demar tomorrow and see what the principal or what Lexi will do. I'm pretty sure she'll just send an email to the principal or the dean, and they'll probably respond till next week because I know they're they're out in break. So yeah, we can definitely work that out and see if we can make that happen.
Mhm.
Right. Thank you.
Yeah, of course.
And I can help get some, students involved since I'm good in convincing people. So I might can get them like involved on this type of program.
That would be awesome. Please.
Yes.
I wish I was a good convincer. What a good skill to have.
Cool. Well, do you have anything else you want to say before I stop the recording?
I'm good.
Okay.
Thank you for listening.
Yeah, I think I'm all good too. Yeah, thank you so much for this opportunity.